The latissimus dorsi, plural, latissimi dorsi, meaning broadest, muscle, of the back, Latin latus meaning broad, latissimus meaning broadest and dorsum meaning the back, is the larger, flat, dorsolateral muscle on the trunk, posterior to the arm, and partly covered by the trapezius on its median dorsal region. Latissimi dorsi are commonly known as lats, especially among bodybuilders. The latissimus dorsi is responsible for extension, adduction, transverse extension also known as horizontal abduction, flexion from an extended position, and, medial, internal rotation of the shoulder joint. It also has a synergistic role in extension and lateral flexion of the lumbar spine. Due to bypassing the scapulothoracic joints and attaching directly to the spine, the actions the latissimi dorsi have on moving the arms can also influence the movement of the scapulae, such as their downward rotation during a pull-up. Structure variations. The number of dorsal vertebrae to which it is attached varies from 4 to 8, the number of costal attachments varies. Muscle fibers may or may not reach the crest of the ilium. A muscular slip, the axillary arch, varying from 7 to 10 cm in length, and from 5 to 15 mm in breadth, occasionally springs from the upper edge of the latissimus dorsi about the middle of the posterior fold of the axilla, and crosses the axilla in front of the axillary vessels and nerves, to join the undersurface of the tendon of the pectoralis major, the coracobrachiolis, or the fascia over the biceps brachii. This axillary arch crosses the axillary artery, just above the spot usually selected for the application of a ligature, and may mislead a surgeon. It is present in about 7% of the population and may be easily recognized by the transverse direction of its fibers. Guy et al. Extensively described this muscular variant using MRI data and positively correlated its presence with symptoms of neurological impingement. A fibrous slip usually passes from the upper border of the tendon of the latissimus dorsi, near its insertion, to the long head of the triceps brachii. This is occasionally muscular, and is the representative of the dorso-epitrochlearis brachii of apes. This muscular form is found in 5% of humans and is sometimes termed the latissimus condyloides. The latissimus dorsi crosses the inferior angle of the scapula. A study found that, of 100 cadavers dissected, 43% had a substantial amount of muscular fibers in the latissimus dorsi originating from the scapula. 36% had few or no muscular fibers, but a soft fibrous link between the scapula and the latissimus dorsi. 21% had little or no connecting tissue between the two structures. Triangles. The lateral margin of the latissimus dorsi is separated below from the obliquus externus abdominis by a small triangular interval, the lumbar triangle of Betty, the base of which is formed by the iliac crest, and its floor by the obliquus internus abdominis. Another triangle is situated behind the scapula. It is bounded above by the trapezius, below by the latissimus dorsi, and laterally by the vertebral border of the scapula. The floor is partly formed by the rhomboides major. If the scapula is drawn forward by folding the arms across the chest, and the trunk bent forward, parts of the 6th and 7th ribs and the interspace between them become subcutaneous and available for auscultation. The space is therefore known as the triangle of auscultation. The latissimus dorsi can be remembered best for insertion as the lady between two majors. As the latissimus dorsi inserts into the floor of the intertubercular groove of the humerus, it is surrounded by two major muscles. The teres major inserts medially on the medial lip of the intertubercular groove, and laterally the pectoralis major inserts into the lateral lip. Innervation. The latissimus dorsi is supplied by the 6th, 7th, and 8th cervical nerves through the thigh or ectodorsal, long scapular, nerve. Electromyography suggests that it consists of 6 groups of muscle fibers that can be independently coordinated by the central nervous system. Function: the latissimus dorsi is responsible for extension, adduction, transverse extension also known as horizontal abduction, flexion from an extended position, and medial, internal rotation of the shoulder joint. It also has a synergistic role in extension, posterior fibers, and lateral flexion, anterior fibers, of the lumbar spine, and assists as a muscle of both forced expiration, anterior fibers, and an accessory muscles of inspiration, posterior fibers. Most latissimus dorsi exercises concurrently recruit the teres major, posterior fibers of the deltoid, long head of the triceps brachii, among numerous other stabilizing muscles. Compound exercises for the lats typically involve elbow flexion and tend to recruit the biceps brachii, brachialis, and brachioradialis for this function. Depending on the line of pull, the trapezius muscles can be recruited as well. Horizontal pulling motions such as rows recruit both latissimus dorsi and trapezius heavily. Training: the power/size/strength of this muscle can be trained with a variety of different exercises. Some of these include vertical pulling movements such as pull-downs and pull-ups, including chin-ups, horizontal pulling movements such as bent-over row, T-bar row, and other rowing exercises. Pullovers, deadlift, lifting under control can help reduce chances of injury. Clinical relevance: tight latissimus dorsi has been shown to be one cause of chronic shoulder pain and chronic back pain. Because the latissimus dorsi connects the spine to the humerus, tightness in this muscle can manifest as either suboptimal glenohumeral joint, shoulder, function, which leads to chronic pain, or tendinitis in the tendinous fasciae connecting the latissimus dorsi to the thoracic and lumbar spine. The latissimus dorsi is a potential source of muscle for breast reconstruction surgery after mastectomy or to correct pectoral hypoplastic defects such as Poland's syndrome. An absent or hypoplastic latissimus dorsi can be one of the associated symptoms of Poland's syndrome. Cardiac support: for heart patients with low cardiac output and who are not candidates for cardiac transplantation, a procedure called cardiomyoplasty may support the failing heart. This procedure involves wrapping the latissimus dorsi muscles around the heart and electrostimulating them in synchrony with ventricular systole.